Hello, this presentation will focus on National Transgender HIV Testing Day awareness. Our presentation will cover statistics, education, aid groups, barriers to care, and resources in Roanoke. I am Lexi, and my other group members are Eli and Kavya. So to begin, I'm going to go over some statistics. We will talk more about the meaning and impact of these statistics later in the presentation. There are 25 million transgender adults globally. As of 2017, there were 1 million transgender adults in the United States. Between 2009 and 2014, 2,315 transgender individuals were diagnosed with HIV in the US. Of those 2,315 individuals, 84% were women, 15% were male, and 1% had a different gender identity. About half of these diagnosed individuals were from the South. Worldwide, transgender women are 49 times more likely to have HIV than the general public. This means that 19.1% of transgender women live with HIV worldwide. In the US, this number is 21.6%. 73% of transgender women are unaware of their HIV status before they tested positive for the first time. HIV has become a significant problem in the transgender community, which is why it is a major flaw that only 39% of strategies for dealing with HIV are inclusive to transgender people.
While these statistics may seem daunting, there are still many ways to educate not just the transgender community, but also the general public about the disproportionate number of disparities that the transgender community face with access to resources. For example, as there are other community organizations that teach and provide information about a wide variety of organizations, both local and nationally. Programs specific to the transgender community should include educational components like pamphlets and factual information by certified medical professionals and risk assessment counselors. These programs could provide free HIV testing, condoms, and access to clean needles using the Needle Exchange Program. Also, these programs could point the transgender community in the right direction if they are in need for support from others in the community about a wide variety of issues. Physicians can also attend these events to guide the community about issues like various HIV treatments like PrEP or AZT. The overall goal is to provide factual, safe, and unstigmatized information for the transgender communities. More information about these programs locally will be mentioned shortly.
So while there's only a few HIV aid groups specifically for transgender people, there are several both in the US and worldwide that have programs designed to support HIV-positive trans people. Two of these major groups in the US are the CDC and the Center of Excellence for Transgender Health. The CDC supports local community-based organizations to develop trans-specific programs for HIV prevention, treatment, and awareness. They also have an initiative called Transforming Health that addresses how healthcare providers can best support trans patients, providing education on their health needs, both in general and surrounding HIV. The Center of Excellence for Transgender Health conducts a wide range of community-based research, including developing trans-specific prevention and treatment programs. Additionally, they provide HIV testing kits, information for healthcare providers, resources to educate people on the transgender community as a whole and on HIV, and facilitate community engagement and outreach. Beyond these, many places in the US have local support systems for HIV-positive trans people through medical systems or LGBTQ groups. Some examples specific to Roanoke will be covered later. Finally, these efforts are not confined to the United States. Several programs exist in other countries to address support for transgender HIV-positive people. Examples of these programs are the Linkages Project in Thailand and the PECHN program in India.
There are many barriers to care for transgender individuals, both HIV-specific and in general. A significant proportion of transgender women have either been thrown out of their home or felt the need to leave due to the environment that they were living in. Many transgender people also struggle with mental illness, depression and anxiety being the most prevalent. These factors can certainly make accessing healthcare much harder, but there are also healthcare-specific factors that are barriers. Many transgender patients have either been refused care or been harassed while obtaining care. Because of this, many have delayed seeking care due to their past experiences. There is also the issue of many primary care providers not having the medical knowledge to treat their transgender patients. All of these factors increase risk for either contracting HIV or remaining unaware of a positive HIV status. This helps explain why transgender people are less likely to report an HIV drug adherence of above 90%.
So we also wanted to touch on some of the resources available in Roanoke for the transgender community. We wanted to remind everybody about our co-host for these projects, the Drop-In Center. They do incredible work for promoting HIV care and treatment for all individuals, along with many other unique programs directed at certain groups. For the transgender community, the Drop-In Center offers HIV testing and counseling while also referring patients and clients to other groups around the Roanoke Valley. The Roanoke Diversity Center is a community-based organization that advocates for the rights of the LGBTQ+ community, and TransparentUSA.org has a local chapter in Roanoke for parents of children that are transgender.
Beyond these, HIV treatment and other medical care that includes trans-Pacific health can be found at the Carleon Clinic. They have many locations and offer a wide variety of health services. 2 nearby locations for their family medicine clinics are in Salem and Roanoke, whose numbers are included here for easy access. Lastly, there is a local Facebook group for the transgender community in the Southwest called Ladies and Gents of the Blue Ridge Transgender Alliance. They have social support and awareness events for the community.
We just wanted to demonstrate our resources and thank you for your attention.